Hello, my name is Robert Ryan III. In this presentation, I will share key findings from the Cone Health 2022 Community Health Needs Assessment focused on Rockingham County and the broader service area, then highlight mental health needs, social determinants, and practical ways the church and Christian population can help. Rockingham County, North Carolina is home to approximately 91,000 residents and is characterized by its predominantly rural setting, with small towns such as Reedsville, Eden, and Madison-Maiden forming the core of the community, according to the U.S. Census Bureau 2021. The county's demographic profile reflects a population that is 72% white, 19% black or African American, 4% Hispanic, 1% Asian, and 2% other racial groups, Cone Health 2022. A notable feature of the population is its age distribution. Rockingham has a higher percentage of residents aged 65 and older and a lower percentage under 18, while child poverty rates exceed the state average, Cone Health 2022. Economically, the county faces challenges with a median household income of $49,604, and for black households, the figure drops to $35,254, underscoring persistent disparities. Despite these economic pressures, Rockingham maintains a home ownership rate of approximately 70%, which is above the state average, signaling a measure of stability within the community. Cone Health 2022. These demographic and socioeconomic factors shape both opportunities and barriers to health and well-being, influencing priorities for public mental health interventions. I chose Rockingham County because it is where I currently reside. Beyond that connection, Rockingham stands out for two notable facts. First, it has the highest years of potential life lost (YPLL) rate in the region, which signals a significant burden of premature mortality and underscores the urgency of addressing health disparities. Second, despite economic challenges such as lower median income and high poverty rates, the county maintains a home ownership rate of about 70%, which is higher than the state average. This resilience in housing stability offers a unique strength to exploit when designing community-based interventions. According to Cone Health 2022, the CHNA ranks Rockingham County's top 10 needs as access to health care, education, economic stability, maternal and child health, behavioral health, healthy eating and activities, social determinants of health, opioid-related substance use disorder, diabetes prevention, and education-related determinants. These priorities reflect systemic challenges that influence both physical and mental health outcomes. CHNAs map the current state of health and inform Cone Health's implementation plans and partnerships. They are also part of IRS requirements for nonprofit systems. Improvements include more effective door-to-door sampling of underrepresented groups, consistent tracking of both broadband access and transportation as key determinants, alongside reducing bureaucratic barriers that keep families from services. The most pressing public mental health concern for Rockingham County is behavioral health access shortages. According to the Cone Health 2022 CHNA, provider scarcity, rural geography, and limited awareness create significant barriers to care. These gaps lead to untreated conditions, higher rates of crisis-level interventions, and increased reliance on emergency services. While opioid misuse and economic stressors are serious secondary drivers, they are compounded by the lack of timely access to mental health care professionals. Improving access through integrated care models, mobile units, and expanded crisis services would create a synergistic impact on reducing the mental health burden across the country. Regarding current strengths, capacity has grown through crisis services, behavioral health integration in primary care clinics, Care Connect referral services, and mobile health units. Cone Health also provides transportation for patients, averaging hundreds of rides daily, which can be pivotal for access in a rural context. Cone Health 2022. The CHNA details social determinants of mental health, SDOMH, in shaping outcomes, which include food insecurity, transportation, housing affordability/quality, and broadband access, all of which are embedded within structural inequities in education, income, and wealth. Each determinant predicts higher prevalence of anxiety, depression, and substance use when needs go unmet. Cone Health 2022, Barrett et al. 2025. Pertaining to local factors, for Rockingham County, three drivers stand out that most influence mental health: access, financial insecurity, and housing instability. Solutions include incorporating behavioral health and routine care, wealth building and navigation supports, and housing first models with coordinated services that preserve and expand affordable housing. Conehill 2022, Barrett et al. 2025. Churches and Christian communities have a unique opportunity to address mental health needs by leveraging trust, relationships, and resources. According to Perez et al. 2024, faith communities play a vital role in reducing stigma and improving access to care through education, screening, referrals, and training clergy to recognize mental health concerns. Perez et al. 2024 also note that these partnerships have been shown to increase mental health literacy and strengthen linkages to professional care, creating a bridge between spiritual and clinical support. According to Lloyd et al. 2024, beyond formal interventions, churches can foster support networks and peer care, offering safe spaces for connection and resilience. Barrett et al. 2025 note that churches can also champion digital inclusion, ensuring that individuals have access to telehealth and online resources, and advocate for safe, stable housing, which is essential for mental well-being. This embodies Matthew 25 verses 40 through 45, serving the least of these, with practical care. English Standard Version 2001. By combining spiritual care with practical strategies, faith communities can become powerful partners in promoting mental health equity. Conclusion: Rockingham faces significant yet addressable mental health needs. The fastest gains will combine clinical integration with SDOMH solutions. Partnering broadly to include health systems, schools, churches, and community groups, and acting now on access, finance, housing, broadband, and equity will significantly improve well-being across the country. Thank you for listening.